Hi, good morning Frank. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 22nd of March 2022. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Frank Midland.
And what is your candidate number, please?
My candidate number is 202371445.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
Next, we can move to the warm-up session. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihiraa.
What are your professional goals?
I have several professional goals. A few important and most achievable professional goals shortly are joining the Emergency Nurses Association and becoming an emergency room nurse practitioner. The second is to earn my master's in nursing. I love teaching, and also, I would like to guide young aspirants to become successful nurses and have excellent careers. Thus, I hope to mentor nurses and share what I have learned.
What are your strengths and weaknesses?
My greatest strength comes from my ability to educate and empathize with patients. I can speak in their terms and help them understand what's happening with their bodies. I strive to enter into their shoes and treat them as people first, not just patients. My greatest weakness is overcommitting. I am so passionate about the job that I try to do too much at times. I need to slow down and trust my team.
Do you like working with a team?
I thrive while working as a part of a team because of my ability to adapt. Working on a team allows for the best outcomes for patients. Everyone has a different way of looking at a problem, and multiple perspectives can bring about creative solutions. Also, working on a team motivates me because I enjoy celebrating the successes of others. However, I feel confident in my ability to work alone as well.
How would you deliver bad news to a patient or their family members?
It is a tough but inevitable part of the job, and I believe I have learned to navigate it effectively. I understand how hard it is to watch a loved one feel uncomfortable, so I always try to demonstrate empathy when speaking to patients' family members. I calmly explain the patient's condition and the next steps we need to take, giving them time to process that information and ask as many questions as they need. Even though the news must be upsetting, I knew I needed to be honest about the situation to manage their expectations appropriately. I would never want to give families false hope about the outcome. However, I also emphasized our medical team's commitment to providing him with the best care and treatment options available.
Nursing can be stressful. What measures do you take to deal with the stress related to this job?
Stress is part of my job. However, I never let it get to me. If I get stressed out while working, I look for opportunities to take a break, laugh, or commiserate with my coworkers. Off the job, I make sure to keep myself in good health by eating right, getting a lot of sleep, and exercising. I also practice mindful meditation.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hi Mihiraa, I would like to confirm that your wound dressing has been completed successfully, and you will be discharged soon. How do you feel about going home?
I feel much relieved to hear, nurse. Getting discharged is good, as I can be in my comfort zone and can take rest.
Yes, that's true. By the way, Mihiraa, I am here to guide wound care after discharge.
All right, you may please.
Mihiraa, it is very important to take care of your wound from getting infected. First, let us discuss the burn infection. Burns can sometimes lead to further problems, mostly due to infection.
Oh, I see.
Yes, Mihiraa. Wounds can become infected if bacteria get into them. The burns tend to rapidly acquire a variety of bacteria that cause infection. This problem increases with the extent of the injury.
Okay. I understand that.
That's great. Mihiraa, it is very important to treat the wound carefully. If the wound is infected, it can be painful, prolong healing, and can lead to further complications. In rare cases, an infected burn can cause blood poisoning or toxic shock syndrome. These serious conditions can be fatal if not treated. Therefore, proper wound care prevents infection and other complications. It also helps speed up the healing process with less scarring.
Well, nurse, how can I prevent getting infected?
I appreciate your question. I will explain steps to follow to prevent infection. The role of topical antibacterial prophylaxis will delay the bacterial acquisition. The need for rigorous hygiene in the management of burns is inevitable, especially hand disinfection, before wound management. Apart from that, wash the burned area with mild soap and lukewarm water, and gently wipe the area to remove all drainage and creating to keep it safe.
Okay, nurse. I got it.
Now, cover all open burn areas by wrapping a sterile gauze roll over the dressings. Do not wrap or tape the wrap too tightly, because this can reduce blood flow to the limb.
Okay, nurse, I'll do it carefully.
Mihiraa, healing burns can be painful. Therefore, you have been prescribed morphine, which must be taken 30 minutes before changing dressing for the first 3 to 4 days.
But nurse, I think antibiotics are needed for my safety.
Your doubt is quite natural. I would like to assure you that, for your current condition, antibiotics are not needed. Only if your wound is getting infectious or delayed healing, then you require antibiotics.
All right, nurse.
To deal with the situation, some therapies are essential. I will outline those for you.
I think it will be helpful. You may please explain it to me.
Definitely. Suggested treatment includes hand elevation. In the acute phase, from the first day position, the extremities and hands need to be elevated above the heart level for 24 hours. Additionally, passively mobilizing the affected joints and surrounding nodes are also necessary. It gives good results in the reduction of edema.
That's great. I will do it.
In the post-acute phase, blood circulation massage is essential to be carried out 3 times a day. I hope it is clear to you.
Yes, nurse. I will do as you suggest.
Thank you for accepting my suggestion. Moving further, when that is being said, I would like to inform you of the signs of infections. Changes in the color, amount, or odor of the drainage, swelling or redness around the burn, and increased pain at the site are common symptoms of infection. Moreover, if you are not eating and drinking as usual, it can be due to complications. Along with that, a lot of bleeding during dressing, and changes in how your arm looks, cool or hot to touch, and a fever that lasts more than 2 days, are also indications of infection.
All right, I'll check for these signs. And nurse, when can I go home?
Your doctor will do a final check and will provide a discharge summary. Also, medications will be provided by the pharmacy. This will take another 30 minutes to complete.
Okay, that's fine.
Mihiraa, do you have any further questions?
No, nurse, I am all good.
Mihiraa, I hope my explanations are clear to you. And always, feel free to contact us for further information. I wish you a speedy recovery.
Thank you, nurse. That is the end of your OET-speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.